Hi everyone, welcome to the 2020 virtual edition of Digital Innovation in Mental Health Conference that I'm happy to join with my speech entitled Beyond the Walls Through Virtual Reality and Mental Health Perspective. My name is Valentino Megale, Ph.D. in neuropharmacology and currently CEO at the digital health startup Softcare Studios. Our goal is improving patients' adherence to therapy, supporting their mental well-being, providing optimized virtual reality experiences. We're based in Italy, and in the last 3 years, we grew, establishing partnerships with universities and pharma companies on an international level, and with charities and foundations as well, developing immersive projects to bridge the opportunities of digital technologies and the challenges faced daily by patients during their therapy journeys. Today, based also on our work, I'd like to briefly present what VR can provide as a digital health tool. But first, let's start from the core of our activities and users. It's August 2020 and we live in the age of distance. COVID-19 disrupted our life routine, in some countries confined us at home during the lockdown, and increased the distance between us and our friends, our family, our activities. However, what we understood is that physical distance is not the most meaningful one. And despite social distancing, we worked hard to build and maintain the core of our relationships. That's to say, communication and its quality with all the people of our community. We also understood that space, the physical space we live in, matters, and that how we spend our time in the space matters too. And we did everything to improve both, especially during the lockdown when we stayed forced at home. It not always resulted in a success, and as emerged from the researchers and from the World Health Organization statistics, the numbers of stress and anxiety-related conditions increased in the population under prolonged lockdown, and also PTSD-like symptoms emerged in patients after the intensive care treatments. So mental health became a mass emergency because of the disruption of our space, time, and relationships routines. This whole experience was new for the most of us, but unfortunately, it is often the normal thing of many people experiencing therapy and long-term hospitalization. In that case, the uncertain journey through the disease creates deeper and wider gaps between patients and their aspirations, between their past routine and their new hospital normal, between them and their community of friends and parents, with the same potential effects on their mental and social well-being. In both cases, finding a way to fill in those gaps is an essential strategy of prevention in order to avoid that the potential issues become real. In the age of distancing, digital technologies clearly emerged as a useful solution, a tool to bridge those gaps and reconnect people with their communities and activities. Our computers, smartphones, and tablets allowed us to stay in touch with others and try to use better our time despite physical limitations. However, the screens we use to explore the digital layer of our society have still limits. When we are forced in a specific environment, a screen still fixes us in that context. We are separated from that, and all the limitations of our settings still impact us. This is true for the general user, and it's more true for hospitalized patients. We're distracted, but still there. From this perspective, virtual reality is a technology able to fill the gaps, taking one step forward. Using a hardware interface named VR headset, virtual reality is designed to elude our senses and simulate our presence in other places from the one where we are with our physical body. When inside, we are not distracted by our surrounding environment, by its limits, by the connected stress, and for a moment, we are allowed to go beyond the walls. Something meaningful if the walls are those of a hospital room. When the virtual experience is well designed, the sense of presence, the illusory sensation of being inside of that virtual environment, is powerful enough to convince our brain to react to the provided digital stimuli. That brings to our attention the importance of our psychomotor loops that form the basics of our daily perception and interaction with the physical reality. Based on what we perceive, our brain processes those information and triggers a wide variety of reactions that helps us catch an opportunity or avoid a risk, and this way grow and adapt to reality. Virtual reality offers us the opportunity to leverage the potential of our psychomotor loops, stimulating our senses and triggering our reactions that can be motor, sensory, emotional, and social. What's more important, we can design specific VR scenarios to guide the user's reactions towards a direction that is meaningful for a desired context. For instance, for the outcomes of a therapy and for patients' well-being. Based on this, the academic and clinical interest of using virtual reality as a digital health tool increased. Researchers and medical specialists are using VR as a not invasive and drug-free tool for a variety of applications, from speeding up the recovery time during psychomotor rehabilitation to treating eating disorders and supporting patients with PTSD. Also, and with great access to manage anxiety and reduce pain perception. Anxiety and phobias management is probably one of the best use cases of VR since the 90s, with pioneering studies by Dr. Hunter Hoffman constantly confirmed and validated by new researchers emerging on the international scenario, thanks also to VR headsets that are becoming more and more accessible and providing better performance and usability at the same time. This aspect allows to introduce them in a wider variety of settings, showing how VR is able to reduce anxiety levels even up to 60%. Similar positive results emerge in the field of pain management, where VR can successfully compete even with other digital tools like screen-based video games, reducing pain perception up to 20–30%. As shown since the 90s studies performed also by Dr. Hunter Hoffman with its project Snowworld, dedicated to patients with polyburns, virtual reality is far beyond just a distraction tool and is able to deeply engage brain areas processing pain, reducing their overall activity. These evidences lead us to develop our immersive experiences at Softcare Studios, focusing first at the most fragile and vulnerable kind of patients, pediatric patients, in settings such as oncology, dentistry, and orthopedics. Our first project, Tommy, was designed specifically to engage hospitalized children through an immersive and gamified approach, providing anxiety and pain relief, helping them better cope with therapy challenges, and giving them a way to go beyond the walls of the hospital. Currently, we are working with 5 hospitals in Italy and 1 hospital in Houston in the Texas Medical Center, with ongoing qualitative and quantitative pilots for a scientific validation of our content. COVID-19 emergency surely disrupted the timeline of our researchers. However, we expect to complete data collection in the second half of 2020, basically reconnecting our work with the initial topic of today's speech. What qualitative pilots already showed to us is how VR is able to act not only as a pain anxiety relief tool, but also as an innovative communication platform, supporting social resilience and cohesion in critical medical settings. Tommy has been designed to involve both patients and their caregivers, their parents, in collaborative sessions, and that lead them to use Tommy as a medium to dialogue together, beyond the invasiveness of the disease topic that is disrupting constantly their entire life. What's even more interesting, we saw that this impact is not only related to patients and their parents' communication, but also patients and the communication with the health operators, generating a healthier social ecosystem able to process daily stress through the natural and human strategy, relationships, and empathy. The opportunity to boost the quality of communication of a real setting using a virtual tool deserves attention both for the hospitalized patients and the general user. Moreover, it is essential to take into consideration the diversity related in the communication process. Patients present a great cultural and social diversity base, and it's very important to design VR experiences that are able to support patients beyond those differences. It's a matter of accessibility to the process, and it relates also to the health diversity, such as the presence of basic disabilities that would limit the use and the access to VR experiences. For that reason, we are also working to develop new ways of interaction with virtual scenarios, even in case of motor disabilities. Among others, we're planning to explore how use sensorial cues to trigger similar haptic stimuli, leveraging the synesthetic potential of VR. This is a study that we're planning with Dr. Mark Shepard and Dr. Becky Inkster. And please, whoever would be interested to know more about it, maybe join and work together on that, please feel free to contact me. What this entire experience teaches us is that digital technologies such as VR represent a great opportunity to fill in the gaps between users and their needs. And technologies are not doomed to isolate us and reduce interpersonal communication. They can improve that. They can improve the quality of relationships, especially in the age of distancing. Obviously, it depends on how they're designed, how we provide those solutions, and how they are used by end users. Before the end, I'd just like to communicate that on the scientific editing platform Frontiers, a new research topic has been presented recently dedicated to virtual reality in pediatrics. We are personally glad to be part of the editor's board together with Dr. Becky Inkster and Dr. Jessica Stone. And anybody interested to submit his research to bring more focus on the field is more than welcome. For any question, let's get in touch on my LinkedIn. It was a pleasure. Thank you for your attention and hope you enjoyed it.